My name's Michael John von Hörsten. I'm from South Africa. I'm a medical doctor. I've been working in this bus for about, it's my 5th week now. I've just quit my job to come here because this is like such a nice place to be at the moment, to do work like this. That it's really a privilege to be here. So I'm here for the long run, I think. So we'll see how long it lasts, but I'll be here for a few more weeks.
So why is it important to be here?
Well, to me, the big thing here is it's a humanitarian crisis that we're dealing with at the moment. We're seeing thousands of people walking through on this road every single day. A lot of sick kids, a lot of sick people. This bus is packed out. This bus clinic is packed out quite frequently during the day. We're seeing pretty serious people, this is the only good medical coverage that you're going to get is field hospitals like this along the beachfront up in the north here. These people have been travelling for, some of them have been travelling for months, some of them 3 months, walking, they're sick, and they have had no medical care at all. Having a facility like this is crucial for them, especially after they've made the crossing. We're seeing a lot of small babies coming across, elderly people. We had a 105-year-old woman the other day that we took off the boat. Had a 1-day-old infant also 2 days ago. Soaking wet, born on the beach just before the boat left. The variety of patients is just incredible, and these people have had no medical care, many of them for weeks on end, months on end. Many have lost their chronic medications. We see people with a lot of special needs children, cerebral palsies, kids with syndromes, and the family have come to Europe to obviously escape conflict and to try and give their children a future despite their special needs. So it's playing a crucial role, just having good medical coverage to meet the arriving boats. So that's what I'm finding.
How is that working out for them once you give them medical help? Then they go on to stage their zone 2, which is the camp, and then from there they go to another place in Europe. How is that working out for them?
So basically what happens is patients arrive, the boats arrive, we have medics on the beach, the various organisations. We do quick medical assessments on each person that comes through, and we just screen them for serious medical conditions. Anything serious we manage on the bus, particularly hypothermia. We have a lot of cold kids coming in, cold elderly people that we have to warm up and manage. Once we've stabilised the people, if they're really ill, we send them straight across to Mytilene, which is the main city on the island of Lesbos here. They get treated there. If they're really ill, they get sent across to Athens for definitive medical care. Other than that, if they're pretty stable and quite well, they get food here, they get clothing, dry clothes, and they get sent up to what they call stage 2. Stage 2 is a step-down camp, a step-up camp, I should say, just up the road. Transit camp where they stay till the buses arrive to take them to Morrow, which is the main camp on the island. So from Morrow they register and they're processed, and then gradually they get taken across to the mainland, depending on the results of their processing, of course.
So what do you have in your bus?
In our bus we got it's progressing. So we started off as a basic primary care clinic, but the need here is to actually have an emergency unit. So we've been working in collaboration with the local Greek doctors to build up a pediatric high care unit. So right now we have some pretty good pediatric facilities that we're using. Thanks to the local Greek doctors. We've got a pediatric ICU specialist that works with us. We're developing an adult emergency room as well, with advanced life support equipment, so that we're able to manage medical emergencies that come through. So that's our main goal. There's lots of primary care tents on the beach, but we don't have really good emergency facilities. We're 60 kilometers from Mytilene Hospital, which is not a very big hospital. It's already overrun. And if you have thousands of people passing through here with serious medical issues, then we need to have emergency facilities that are located where the crises are. So that's our role as Adventis Help, to have a facility like this on the beach.
So what do you need? Do you need more doctors? You need more equipment?
So right now we've got a pretty good stream of doctors coming in, but it varies from time to time. So there are times when the amount of medical staff does decrease. We've noticed when the weather gets bad, the amount of volunteers on the ground definitely does decrease. And with with December coming with bad weather on its way, we're hoping that won't be the case. So if people are wanting to come volunteer, I think it'd be a good idea for them to come. Currently on the north coast here, we're pretty well staffed, but from what I've heard, I might be wrong, but from what I've heard in Morrow and in the camps, the situation's a lot worse with regards to medical staffing, and I think people should have a look there to try and get involved there too as much as they could, because there are literally thousands of people sitting there, and many of them have chronic medical conditions that need to be managed as well.
What about equipment?
Equipment, yeah, we're needing to brush up on some emergency medical equipment. We've got donors that have done wonders for us from all over the world. Groups from New York, we've got groups from Scandinavia, from Germany. We're still trying to improve our equipment. So right now, our current list that we're looking for, we're trying to access a good emergency trolley for our emergency equipment. We're trying to access more jump bags, responder bags, primary responder bags, for medics to patrol up and down the beach fronts to meet the arriving boats. We're looking for a portable ventilator and a few odds and ends like that. We're still working on a good list because donations keep coming in every day. But we're trying to consolidate our emergency equipment so that we can manage whatever comes past. The big thing that I'm concerned about with the changes in weather is I'm concerned about a pediatric mass casualty event. That's what I'm concerned about. The sea gets pretty rough. It's quiet today, but you must see it when the wind starts to blow. It gets really strong. And I'm just concerned, with these overloaded boats, some of them full of babies. We're just waiting for a serious event with a number of near drownings and seriously ill children, and we want to be prepared for that so we can manage that as well as we can. Yeah. We've basically got an emergency pediatric area here, with monitors, suction. Bag valve masks, oxygen, and fluids. And this side we have the pharmacy with pediatric and adult medications at hand. And on that side is our adult emergency area.